you've been diagnosed with polycystic ovaries. What does this mean? If you're experiencing irregular menstruation, it may be because you have too many cysts on your ovaries preventing you from ovulating. Ovulation creates a domino effect inside the body that allows menstruation to come 14 days after you've ovulated. If cysts surround your ovaries and prevent you from ovulating, then it won't automatically kick on and you have your menstrual cycle. The difference between polycystic ovaries and polycystic ovarian syndrome is if you've got the syndrome, not only do you have cysts all over your ovaries that are preventing you from ovulating, but you also have irregular menstrual cycle, excess body hair as well, and in many cases tend to be quite overweight. With polycystic ovaries, you just may have too many cysts on your ovaries that are preventing you from ovulating. Using our formulas can dissolve the cysts that surround your ovaries and allow normal menstruation and ovulation to occur again. Depending on the size of your cysts will depend on how much treatment you require. Some cysts may be too large to be properly dissolved with just our formulas on their own, and you may require surgery for them. Provided your cysts are under 5 centimetres, then there's every likelihood that our formulas will be able to dissolve those cysts off your ovaries naturally and you will be able to ovulate freely. This is not a temporary treatment, it can be a cure. In Chinese medicine, cysts on the ovaries are what we call damp. We have a damp obstruction that prevents ovulation. Now this damp can be seen in overweight women as well. The excess fat that we see on our body in Chinese medicine related to damp. And so when we treat polycystic ovaries, we use formulas that help warm the local area, remove damp and remove cysts. One of the things we encourage while using this therapy is to let us know how big your cysts are in the first place, and after 2 or 3 months, depending on how we advise, go back and get another ultrasound and confirm your results. That way, you know exactly what's happened. Another way you might be able to tell that the treatment has worked is that you start ovulating again and your period comes back to normal. That's also a very good sign. I would suggest that if you are suffering polycystic ovaries and irregular menstruation, and then use our therapies, and your menstruation comes back into step and you begin ovulating again, we would suggest that that is a successful treatment. There are lifestyle factors that have created these cysts in the first place. If these lifestyle factors persist, then you may get the cysts on your ovaries again. But we would suggest that you should go for an extended period of time, months to years, without getting cysts on your ovaries again.